It's been said the journey of 1,000 miles begins with a single step. But what about a journey that spans a century? That is the journey we're on. It's a road paved by the very best team in healthcare, the most compassionate caregivers, relentless advocates, and their never-give-up know-how that delivers the hope and healing we need. But it's a path we are taking to the next level, the next destination. Why? Well, we do it to change a community, to champion the underserved, to diagnose the undiagnosable, to take on what others can't or won't. We do it to create new opportunities, to cement this city and this system as a global destination for exceptional care. We do it to uplift our neighbors, to show we can do more together than apart, to become the Detroit we know we can be. The expectations are big, but our breakthroughs will be even bigger. And the stakes, they've never been higher. It's called making the impossible possible. The journey that took more than 100 years is about to take its biggest leap yet. This will truly be a destination, a grand destination. It's time, Henry Ford Health. Let's go for it.
Good morning. Good morning, everyone. Can you feel the energy? I can feel it. I hope we can all take this in. You know, the historic importance of this moment, our moment, conveys the highest aspirations of a generation. My name is Dr. Stephen Kalkanis, and it's my great honor to serve as CEO of Henry Ford Hospital and CEO of the Henry Ford Medical Group, and to officially welcome all of you to the groundbreaking for what is arguably Henry Ford Health's most transformative project to date. This is the complete reimagination of our academic medical campus and hospital right here in Detroit. You know, it's a project our own hospital team members have named Destination Grand, which is a wonderful play on words, because the future of health will be a beacon of destination care with grand aspirations right on West Grand Boulevard in the city we never left and in the city we've loved for 109 years and counting. And as the leader of Henry Ford Hospital, I know firsthand, this is so much more than just a building, than just a hospital. This is a beacon of hope. This is a community asset. This is the home of the most incredible team in healthcare. This is our future. This is a destination from those who live across the street or across our region, and yes, across the globe. From preventative care to the first in humankind space-age technology that allows us to perform the most complex cases successfully. Caring for all, regardless of who you are or where you're from or what you have. We've said so many times in so many places that there's no great American city without a world-class academic medical center. Well, Detroit is a great American city, and Henry Ford Health is the destination for hope. We will change the health of our world together. Today we stand on the shoulders of giants from past and present, our storied legacy, to see a brighter future ahead for all. And so it's my privilege and honor to introduce a giant in our community, Henry Ford Health President and CEO, Mr. Bob Riney.
This is quite the moment. Thank you, Steve, and hello, everyone. What a wonderful moment in the history of this great organization and the history of this remarkable city. Words cannot adequately explain how grateful I am to have the privilege to lead this incredible organization, an organization that thinks big, cares deeply, values diversity, and embraces all communities. I am both honored and humbled to be here today as we celebrate the official construction kickoff of Destination Grand, our 1.2 million square foot hospital expansion project right here where we're sitting on West Grand Boulevard. Today will be memorable for so many reasons, and I'm so glad that all of you are here. After all, you all play a role in the eventual success of this grand and impactful vision. I want to start my remarks with a moment of gratitude. This project was not one person's idea or a simple business initiative. It's the culmination of decades worth of hopes, dreams, and planning for the betterment of our community, our patients, and our team, and an investment in the city and the people that we love so dearly. Seated right behind me are some of those dreamers and doers, our talented team members, project visionaries, our former CEOs whose visionary leadership paved the way for this incredible project. Without each of them, these plans would not be where they are right now. And I want to specifically call out our former CEOs. Gail Warden was one of the most important. He is and continues to be one of the most important mentors in my life. And it was during Gail's reign, when things in the city were looking very, very challenging, that he said, we're not going, we're staying, and we're investing. And Gail, we thank you. I also want to acknowledge and welcome Wright Lassiter back to Henry Ford. I had the pleasure of serving as COO under Wright's leadership, and Wright again challenged us to be bigger, to think better, to do bigger things. And first thing he said to me when we saw each other this morning was, wow, you guys took that and put it on steroids. So thank you. Thank you, Wright. Former Systems CEO Nancy Schlichting and former Henry Ford Hospital CEO John Popovich were both invited but had plans that they absolutely could not change, but sent their messages of great excitement for the amazing investment in this beloved city. I want to recognize my executive council. They are the rock. I'm so grateful for their support and ideas as we forge ahead. Dr. Kalkanis, CEO of Henry Ford Hospital, Ronnie Hall, the president of Henry Ford Hospital. I've never been anywhere that Ronnie doesn't have a fan club and an entourage at everywhere. And our System and Hospital Board of Trustees, especially our System Board Chair, David Breen, thank you for everything. Jerry Darby and Annette Phillips, our VPs of Campus Planning and Development, their counsel and leadership on this project has been second to none. And then let me just quickly, and we can hold our applause to the end, acknowledge the many political leaders that are just so enthused about what we're doing and ready to partner with us in every way. And they include from the city, Keith Butler, Joshua Robertson, Brian Coe, Antonio Bryant, Malia Howard, Jose Lemus, Brandon Lockhart, Hassan Beydoun, Aaron Goodman, and at the state level, Senator Stephanie Chang, State Representative Natalie Price, State Representative Mike McFall, State Representative Veronica Pies, Carolyn Shannon from U.S. Senator Peters' office. And if I missed anybody, I apologize, but thank you, legislative leaders, for your support. We're also so fortunate to have some incredible partners whose collaboration allows us to reach new heights, and we are showing the power of partnership. Our special thank you to our Future of Health Detroit partners, Tom Gores, Arn Tellem, who's sitting next to Wright, and the great Detroit Pistons for their commitment to this city. As well as President Kevin Guskowitz, Dr. Norm Hubbard, and the great Michigan State University. Someone that you're going to get to know and this community is going to love, Dr. Pablo Selnick and the Shirley Ryan AbilityLab. And last but not least, amazing, amazing stewards of everything that we are so fortunate to do in our city, Dan and Jennifer Gilbert and the Gilbert Family Foundation. What we are accomplishing together is so much greater than any of us could ever do alone. And that's the power of Detroit. That's the lesson of Detroit. And most importantly, from the bottom of my heart, the deepest amount of gratitude go to the 30,000, soon to be 50,000 team members who wake up every day focused on the betterment of our community, our team members. They are our heart and soul of this enterprise, and Steve, the neurosurgeon, will get mad if I don't say, and the brain. You make Henry Ford the dynamic and world-class organization it is, and that's what inspires me every single day. I'm in awe of the compassion and the innovation of care that is delivered in this enterprise on a daily basis. We are so excited to give our team members a world-class space that matches the world-class talent. We have proudly been an anchor in this neighborhood for more than a century. 109 years, as Steve said, to be exact. The groundbreaking that happened before the opening of Henry Ford Hospital was led by Henry Ford himself. Today, all of us get to participate in the next 100 years of making the impossible possible get started. How lucky we are. And I can see, and you can see, that I had a lot of people to thank, and I could keep going. But the point is that this is a community, and we're building on this community something that is so important and so monumental that it is about Team Detroit. It takes partners like we have here today who share our values, and it starts with that. Our commitments to serving the people of this community and beyond. On a cold winter day in 2023, many of us stood not far from here at the Henry Ford Detroit Pistons Performance Center to announce our vision to transform this neighborhood through the reimagination of our academic healthcare campus. On that day, we put a stake in the ground here in Detroit, pledging to continually lead clinical innovation and discovery, championing opportunities for the next generation of healthcare professionals, driving economic mobility, and eliminating health disparities and championing equity for all. You can clap for that. And a really great and sustainable place to live, work, and play for everyone. Today we're here to celebrate an incredible milestone in the hallmark of this Future of Health Detroit vision. Our incredible expansion of Henry Ford Hospital, the place where it all began, the place where it will continue for the next century and beyond. Just across the Lodge Freeway, the Henry Ford Michigan State Health Sciences Research Center and the Nick Gilbert Neurofibromatosis Research Institute, headquartered within, will be a place where life-changing research happens every day. And in and around all of this will be a thriving community hub with residential housing, all income housing, dining, retail opportunities, and lots of green space made possible by Tom Gores and the Detroit Pistons. We are setting the stage for Detroit to become the national academic medical headquarters. We are poised to deliver on this for the great city of Detroit, and we are the only ones that collectively can make it happen. Is our vision bold and ambitious? You betcha. But we know how to do this. We've served as an anchor institution in Michigan for more than a century, and more importantly, we have grit, we have grace, and we have each other. And with the plans we have before us, the very work you see happening all around us, we can truly say the best is yet to come. Thank you.
Thank you, Bob. Greetings, everyone. What an amazing morning, right? Give yourselves another round of applause. I'm Denise Brooks-Williams, our EVP and CEO of Care Delivery Operations. I'm an incredibly proud member of this team, as Bob has been describing. I am also a lifelong Detroiter and incredibly proud of what this project means for us, the reason we're here today, and the vision that we're sharing. It's incredibly personal to me, and I'm incredibly excited. I heard applause. I want nothing more than to see the city and its people thrive in health, thrive in prosperity and economic opportunities, thrive in well-being. As someone who's been a part of over 100 community meetings, and I see many of those community members here today, had the opportunity to meet with thousands of our neighbors, congregation members, local leaders, business owners, and schools over the last months and even to some degree years. I am incredibly proud and happy to say that we have personally included a lot of the input that came from those groups. And this is really a vision that we share with the community. We listened and we incorporated the needs and desires of our neighbors. And what you'll see, a prime example, is in the work that we'll be doing, those ideas will be manifested. We will offer a brand new fast track in our emergency department where we're designing a way to address direct results of needs that the community will have. You'll also see that we are able to address the concerns that the community brought to us in those many conversations. With that in mind, we have a critical partner that's here today that it's my privilege to be able to introduce the mayor of our amazing city, Mayor Mike Duggan.
This is truly an historic day. About 110 years ago, the great mayor of Detroit, Hazen Pingree, broke ground on a new street that was the outer limits of the city borders. It was called Grand Boulevard. And he was right out here and he broke ground. And shortly after that, Henry Ford Hospital broke ground on the hospital that sits there. But the 99 years since Henry Ford Hospital opened, for healthcare in the city of Detroit, the trend hasn't been that great. In fact, you've been around, most of that century was a loss of healthcare. Providence Hospital, you all know, is in the suburbs, right? It started in the city. It left Detroit and went to the suburbs. St. Joseph Mercy is in the suburbs, right? They started in the city. They left Detroit and went to the suburbs. The names longtime Detroiters remember: Mount Carmel, St. Mary's, Blaine, Southwest, Doctors Hospital, Memorial Hospital. Hospital after hospital closed, while Henry Ford continued to provide great care. Now, I happen to know this history because this was personal for me. In 2003, the Detroit Medical Center Board voted to close Receiving Hospital, Hutzel Hospital, and the Carmanis Cancer Center. And I was the prosecutor at the time. I took the job at DMC because I thought, who's going to take care of the people of Detroit? And as I was coming in, Saratoga closed, Holy Cross closed, Riverview closed. But you know what was interesting? As I came in trying to figure out what to do, Henry Ford put another $100 million into their Detroit campus. They made a commitment to keep their corporate headquarters in Detroit. They started opening clinics in Detroit when everybody else was leaving. And it wasn't politically popular. It was the Henry Ford system the state invested. And of course, I was a little competitive myself. And so when I came into DMC, I said, we're going to expand, we're going to grow. And we started competing every single day. And I competed with Henry Ford over every doctor, over every research grant, over every residency and academic program. And I'd sit in a room, I think I'd have a deal done, and the doctors group would say, well, you know, Bob Riney offered me this. You know, Bob Riney's proposing that. I'm like, who the hell is Bob Riney? It turned out, as the number 2 at Henry Ford, we were in hand-to-hand combat for 9 years. And it was tense between us. We weren't really happy to see each other. But a fascinating thing happened. You looked at the national rankings on research, Henry Ford and DMC went up. You looked at the national rankings on quality, Henry Ford and DMC went up. You looked at profitability and patient care, Henry Ford and DMC went up. People started to come back to Detroit for care. And I realized that we had made each other a great deal better, and I realized that Bob Riney was one of the great hospital leaders and smartest administrators I ever met. And so, Wright Lassiter was the CEO here. I was really glad I got here. They built the Harris Cancer Center across the street, a huge investment in Detroit. It was terrific. But when Bob announced he was retiring, I called and congratulated him, that's fine. And then a little while later, Wright said he was leaving. And before it was public, I picked up the phone and I called Bob Riney. And I said, Bob, you have to be the CEO. He says, Mike, Sandy and I have plans. I'm going to do this with my daughter. I'm going to do this. I can't do it. And after about 15 minutes, I kind of got mad and I started to yell at him. And I said, the historical stakes for Henry Ford, the historical stakes for the city of Detroit for a project of this magnitude, you are the only one that can pull it off the way it needs to be done. I said, Bob, you have a moral obligation to take this job. And he says, I got to get my mind around this, Mike. He says, for 9 years, you made my life miserable every day. He says, I thought you hated me and were trying to get me fired. And I said, Bob, I was just joking during those 9 years. But the interesting thing is the Henry Ford community, the Henry Ford board leadership, they all went to Bob Riney too and said, this is a critical time. And Sandy, we will always be enormously grateful because I know you were supportive. But Detroit doesn't really like change. And when you're talking about a $2 billion investment, it's very difficult to pull off. But here's the thing that Bob understood about the community. He didn't make it about a hospital. He went out and got Michigan State in a $300 million research center. Now we've got greater research capacity. He realized the neighborhood would be gentrified and went to Arn Tellem and to Tom Gores and said, we got to build hundreds of new housing units so people are not pushed out of this neighborhood. Who thinks like that? And then to get with Dan and Jennifer Gilbert for this extraordinary Shirley Ryan Rehab Center is going to be transformational to the people of this city. But doubling the size of the emergency room, you know what that means to Detroiters, right? 500 private patient rooms. For most of my life, the hospital systems have bailed on Detroit and put their investments in the suburbs. And today, we are seeing one of the finest hospitals anywhere in America being built here in the city of Detroit. Congratulations to Bob Riney and the entire Henry Ford team for what you've done.
Thank you to someone who I think should simply be known as America's greatest mayor. What an amazing time for our city. I now have the honor to introduce our president of our care delivery system and our chief clinical officer,
my friend and colleague, Dr. Adnan Munkara, to share the incredible details of what we're building. Adnan.
Well, good morning, Detroit. Good morning, Michigan. Good morning, Hanford Health. Thank you so much, Steve. Thank you, everyone, for being here with us on this momentous occasion. What a thrilling time for our organization, for our community, our city, and our state. I would like you to imagine, feel the transformation that's about to take care in the grounds under your feet. I want you to imagine healthcare facilities where the impossible will become possible. A stunning patient tower, 20 floors, 432 private beds, equipped with cutting-edge technology to serve our patients and our team. Imagine a hospital where we have 5 floors of specialized, personalized intensive care units, where patients with the most complex conditions, cardiac, neurological, cancer, transplant, complex surgeries, and others, will be receiving the most advanced care using 28 new operating rooms, 18 new interventional labs, staffed by top-notch team in the nation and in the globe, and equipped with state-of-the-art technology. Yes, to our team. Imagine room with 75-inch touchscreen TVs, where our teams and our patients will be able to have easy look at their daily schedules, at their care plans, medications, allergies, and many more important information. Video cameras, sensors, monitors that will allow us to extend and enhance the safety of our patients and accelerate access to the caregivers. I would like you to imagine calling out, "Hey, Henry," and the window shades will come down, the lights will turn on, the temperature in your room will adjust from the comfort of the hospital bed, something that we don't get in our at home. As the mayor mentioned, our emergency department is going to go from 35,000 square feet to 75,000 square feet, more than double in its size, to serve in 100 private treatment exam areas to serve our patient with privacy, dignity, and with the best care possible. I could go on, and it will take us an hour or more. Through this development, we are also poised to lead in sustainability and clean energy. This is extremely important for the health of our community. An example is our 46,000 square foot central energy hub, ultra-modern, that we'll be building on this campus. This hub will allow us to heat and cool our facilities using water pump. This will eliminate the need for natural gas, a significant contributor to pollution, asthma, and many medical illnesses. And this will set us up to deliver and exceed our carbon neutral commitment. Extremely important for our community and our climate. For me, an aspiring physician who traveled to the United States over 35 years ago, and for whom Detroit has become home, this is a beautiful dream coming true. All of this sets us up to be the destination for the brightest minds that we have at the present time and we will retain, and the most compassionate hearts in healthcare to serve our patients, whether they seek our care from across the street or around the globe. A place where our patients, nurses, pharmacists, technologists, therapists, and many more we educate and train will choose to have their whole career with us here because of the caliber of our program, the caliber of our facilities, and the caliber of our city. We have committed that Detroit is a world-class city that deserves a world-class academic medical center. We promise this will be it. It is now my pleasure to introduce Dr. Pablo Salnik, the CEO of the Shirley Ryan AbilityLab, the #1 ranked physical rehabilitation institute in the nation and most likely in the globe, to share with us the phenomenal services and facilities that we'll be offering together on this campus. Pablo.
Thank you, Dr. Munkara. Good morning, everyone. We are really honored here to be part of this new era in Detroit, and we are thrilled to partner with the Gilbert Family Foundation and Henry Ford Health to bring the best physical medicine and rehabilitation care to this community. Each year, tens of thousands of people in Greater Detroit survive debilitating conditions, such as stroke, brain and spinal cord injury, cancer, amputation, a figure only expected to grow as the population ages. And for the past 7 decades, Shirley Ryan AbilityLab has pioneered rehabilitation clinical practice and research to care for these very patients, totaling more than 50,000 patients annually coming to our organization from all over the world. Our singular focus is in helping patients regain ability through intensive rehabilitation care that leverages the latest scientific breakthroughs, tools, and technologies, enhancing their ability to function, move, communicate, and return to full lives. Our dedicated pursuit of this mission has resulted in our ranking as the #1 rehabilitation hospital in America by U.S. News World Report every year since 1991. So now, in collaboration with Henry Ford Health and Gilbert Family Foundation, we will bring Shirley Ryan AbilityLab to Detroit, our first such expansion. In the process, we will be bolstered by our shared values and commitment to innovation. We know that traveling for the very best rehabilitation care following a life-changing injury or illness doesn't really come easily. For many, it's not even possible. So thanks to this historic partnership, patients will not need to leave their communities for best care or to have a best chance for recovery. We are so proud to partner with Henry Ford Health on this effort, and I want to thank Bob Riney and all of our friends here for working with us to make this vision a reality. So in addition to the 3-floor, 72-bed hospital that will be included in this new patient tower, we will also plan to bring Shirley Ryan AbilityLab's expertise to other Henry Ford Health acute care hospitals, including those in Macomb and Wyandotte. And in addition to expressing gratitude to Henry Ford Health, I want to extend our deep appreciation to Laura Graneman and the team at the Gilbert Family Foundation for your vision and collaboration. Thank you to Kofi Bonner, CEO of Bedrock, and colleagues across the Gilbert family of companies for your strategic partnership. And most of all, I really want to thank Dan and Jennifer Gilbert, whose personal experience, vision, and generosity has fueled this moment and has helped to set the path for our future. So because of your support, Detroiters will find hope, healing, and recovery right here, close to home. Thank you.
Thank you so much, Dr. Selnick, for your words and your partnership. And in addition to the world-class facilities, at the very top of our tower, you're going to have one of the best views in the city of Detroit. So we're going to come up and see you there. But it is now my profound honor to introduce two of Detroit's foremost philanthropists, some of our most important saviors and protectors of our great city, our partners who have become truly dear friends, Dan and Jennifer Gilbert.
My wife and myself took out two of our kids, two of our boys and their girlfriends to dinner in Detroit. Then we went back to our apartment here in Detroit. We invited some couples over. We were on the deck and I only had two real symptoms that happened to me, which aren't the common symptoms you get in a stroke. So I had cramping in my left hand, and then I thought I was seeing double vision. A friend of ours, he's an ER doctor, happened to be at our place. So he and my wife said, no, you got to get to the hospital. I woke up and I knew right away that my left side was out. I felt like I almost felt like a mannequin, like the left side was like a mannequin. And so we knew we had to leave to get to some rehab facility. And we went deep and looked at a lot of places, and Shirley Ryan isn't like the undisputed place for neuro rehab in the country, maybe the world. One of the magazines that ranks these hospitals for 30 straight years ranked them #1. We flew to Chicago. When I got there, you immediately felt like this was the right place. I mean, just the culture there, the people there knew absolutely what they're doing. We started rehab the very next day. Somewhere halfway through my stay, I said, you know what? It'd be great if one of these was in Detroit because Detroit could use one. They agreed. They said, let's come to Detroit. And so my wife and myself decided out of the foundation that we were going to fund the Shirley Ryan part of the Henry Ford Hospital, new hospital. And Henry Ford's been a great partner, as has Shirley Ryan. And we created a $10 million fund that's going to be able to supplement people who can't afford the treatment. We feel like Detroit and Detroiters deserve the best, and this is the very best. And for us to be a part of that and be able to impact it it's an honor. And having it in Detroit here with all the people that may need this kind of treatment, I mean, what a winner that's going to be for the whole city. Well, thank you all for being here today. What a beautiful day in Detroit. Today is another outstanding day for the city and our entire region. Congratulations to Bob Riney and the entire Henry Ford Health team for your bold vision for the future of health. We are proud to partner with you and bring the best neuro rehabilitation care to our city and our residents. When I had a stroke back in 2019, which you just heard, my life changed dramatically, but thanks to the support of family, doctors, therapists, and staff at Shirley Ryan Ability Center, I began my rehab journey with strength, confidence, and optimism. The journey is not over yet, but I continue to make progress every single day, and it all started at Shirley Ryan. For those who don't know, Shirley Ryan AbilityLab has been named the #1 rehabilitation hospital in the country by U.S. News and Report for 34 consecutive years. That's as long as the Simpsons have been on TV, okay? Give you some perspective there. It's hard to imagine, but once you've worked with them, you understand. I can speak from experience that these accolades are well-deserved. In fact, there was only one problem I had with Shirley Ryan. They were in Chicago. Nothing against Chicago, but after 9 weeks there, I was excited to get back home. I was fortunate to be in a position to seek out the best healthcare options, but not all of Detroit residents have that opportunity to do the same. So it was time to convince Shirley Ryan to build their next facility right here in downtown Detroit. Now, thanks to Henry Ford Health and the Gilbert Family Foundation, the best rehabilitation hospital in the world is coming to Detroit, increasing access to critical care while adding to our city's reputation as a rapidly growing healthcare and research hub. Today is a day of celebration, but also time to think about the future of Detroit. Henry Ford Health's expansion, including the research partnership with Michigan State, will also house the Nick Gilbert Neurofibromatosis Research Institute. This will attract bright minds and talented professionals to our city. It will also create a strong pipeline to careers in healthcare and medical research from our local universities, giving more of our young people a reason to stay home. If you're going to clap, that's the place. Put simply, this investment is not just about making Detroiters healthy, it's about making a stronger, more vibrant Detroit, today, tomorrow, and for many years to come. Thank you very much. Next up is the most important, Gilbert.
As Dan said, this investment is about bringing hope and the highest level of care to those who need it most right here at home. Rehabilitation is a difficult journey, not only for the patients, but for their families as well. Our family knows the toll that a long rehab journey can take. Having access to the world's best services locally will make an enormous difference here in Detroit and throughout the region for so many families. It means that you don't have to travel far from home to get the care you need. Instead, you can heal and recover with the close support of your loved ones. But even a local hospital can be inaccessible without the right financial support. That is why we are also creating a $10 million fund to fill in the critical gap where insurance often ends, but the need for care remains. This fund will ensure that our neighbors in the community get the support they need to fight back from debilitating injuries. Launching an initiative like this takes a lot of work and a lot of collaboration. We are so grateful for the group of passionate people who came together to make this ambitious vision possible. Thank you to Peggy Kirk, Pablo Selnick, Barry Fleischer, and the team at Shirley Ryan AbilityLab for your enthusiasm and willingness to try something different and to expand your impact to the people of our region. Thank you also to Bob Riney, Dr. Steve Kalkanis, and MJ Voigt at Henry Ford for your vision in making this complex partnership possible. Finally, a very special thank you to Laura Graneman, Eileen Ione, Jared Fleischer, and many more members of our teams at Gilbert Family Foundation, Bedrock, and Rock for always working so hard to turn our collective vision for a stronger and more equitable Detroit into a reality. We cannot wait. Thank you. Yep, that's good. We cannot wait to get everyone back together to celebrate the opening of this transformational hospital and the Shirley Ryan AbilityLab. Thank you.
There is no $3 billion project without partners. It takes everybody in the community. It takes a huge amount of philanthropy. And quite honestly, it takes the commitment of multiple organizations to create something of this magnitude.
This was the first time that I've ever witnessed, as far as an entity of this size came into the communities and the neighborhoods and started listening to the communities and the residents of those communities.
It's got to be that true partnership. We too have to be good partners with the community. The more that we can partner and work together as what everybody brings to the table to offer, the better our societies and communities will be.
As someone who grew up in Detroit, it's important to give not only clinical care, but then also the other components that come with Destination Grand, such as the education, the research. I like the way where at every step in the process, community has been engaged and community has been asked, what is important to you? What are your priorities? How do you want to get involved? How can we involve you?
We went to churches and schools to be able to hear their vision of what they thought they needed and wanted. So it literally shaped it in the sense of their voice being heard.
We're proud of our partnership with Henry Ford Health. It is the most important partnership to the Detroit Pistons. We wouldn't be in the city of Detroit but for our partnership with Henry Ford Health.
Michigan State and Henry Ford both understand that the complex challenges society faces, from confronting cancer to healthcare equity, require more resources and know-how than any single organization can muster.
I just think it's so great that they look beyond just being Henry Ford. It's all about, for me, I think, community.
Academic medical center like this, being developed at this level, is a once-in-a-lifetime opportunity for most people, and we're creating it here in Detroit.
And I'm just extremely proud that Henry Ford is choosing to declare that we'll be here for the next 100 years.
Detroit's ability to adapt to any situation and grow from it is just key as far as our survival as communities and the city as a whole.
Everyone wants to do right and cares about their fellow citizens. There's, to me, nothing greater that one can achieve in one's life than to make this kind of difference.
I think that people in Detroit will see that this ends up being one of the best medical institutions in the country.
Community and partnership, they're words you've heard a lot today, and by chance, not. That's because they are integral to what we're doing, why we're doing it, and how. We are so very lucky to have our own City Council President live right in our backyard. She's a partner who's a true voice for our community and who understands a thriving community must be a healthy one. I'm happy to introduce our Council President, Mary Sheffield.
Thank you, Detroit. Such an exciting day to be here. I am incredibly honored to be a part of this historic and monumental moment in the history of our city. This project will truly transform the healthcare and economic landscape of our city and touch the lives of residents for generations to come. The Future of Health project signals growth, progress, and possibility for our city. And it shows the strength of public-private partnerships and what can happen when we come together for a common goal. I am so deeply proud to have supported this project for so many reasons. Access to quality health care has always held a special place in my heart. As a daughter and granddaughter of nurses, I understand the critical value and importance of quality health care, not only for our families, but for our communities. This project, though, is much more than a hospital. It is a catalyst for neighborhood revitalization that I am so deeply passionate about. It is a reminder that health is not just about treating illnesses, it's about lifting up communities. With this project will come job creation, affordable housing, educational opportunities, and much more that would truly transform and improve the quality of life for our city. As we work to build a thriving city, we must remember that economic growth does not always translate to healthier outcomes, especially for our most vulnerable residents. The real success of our city isn't just about new buildings or businesses. It's about the health and the well-being of the people who live here. Health is wealth, right? We've all heard health is wealth. And if Detroit is going to rise again as one of the world's greatest cities and reclaim its national prominence, which I know we all believe in, it starts with the health of its people. This hospital expansion puts us on that road to reaching that global pinnacle, and I am honored to support this project. I would like to thank the development team for working closely with City Council and community throughout this entire process, ensuring that the voices were heard and respected, especially those who lived in the impact area. I would also personally like to thank Dan and Jennifer Gilbert, who always go above and beyond for our city. And in this case, I have to mention again, ensuring access for low-income Detroiters who have limited or no insurance and are dealing with life-changing illnesses and injuries will now have world-class rehabilitation care. And lastly, to Henry Ford Health, thank you for your vision and your leadership. You have been a pillar in our city, and this new chapter reflects your ongoing commitment to not just treat, but to transform the community in which you serve. I look forward to seeing this project come to life and to witnessing the countless lives that it will impact. Thank you to everyone who made this possible. Congratulations.
Thank you so much, President Sheffield. I'd now like to offer everyone to look at the screens on either side, and you'll see some special messages from some well-known supporters.
Hello, Henry Ford Health team. I'm so excited to join you virtually for today's groundbreaking. This new facility and expanded campus will serve hundreds more patients every day, support thousands of good paying jobs, and drive billions of dollars of investment. Best of all, it's right in the heart of downtown Detroit.
Hello to everyone celebrating the groundbreaking of the Henry Ford Health Detroit campus expansion, including my friends, Mayor Mike Duggan, CEO Bob Riney, and the entire team at Henry Ford Health. I really wish I could be there with you for this really important celebration.
Hello, everyone. I just want to say congratulations on today's groundbreaking for Henry Ford's new campus. This new medical campus is going to be a game changer for the city of Detroit, connecting world-class healthcare with new housing and retail spaces in a critical part of the city.
It's never a good idea to bet against Detroit, and we are proving that by showing up and doing the work every single day. The truth is, none of this would have been possible without people like all of you. This was a true Team Michigan effort driven by countless public and private sector partners.
This will enhance Detroit as a medical destination, bringing people from across the state, across the Midwest, and across the country to receive state-of-the-art care. The project will redefine what it means to support the health and well-being of a community. It will connect community care and research in a way that hasn't been done before.
From the expansion in research for cancer to neuroscience to immunology, Henry Ford's new campus will be a major win for patients, healthcare workers, and our entire state. So congratulations on today's important milestone, and I look forward to working alongside you to get this project completed.
The new hospital will make a difference in people's lives, close health gaps, improve outcomes, and build a brighter future for Michigan. So thanks again for your hard work. Congratulations, and let's keep getting it done.
A huge thanks to our wonderful leaders and partners for those awesome messages, and thank you to all of you for playing an important role in today's celebration. We'd also like to have a special thanks. I think I'm giving the brain. No, that's not your brain. Okay.
We have more to choose from.
We have more to choose from. But a special thanks to the local artists who created these amazing hard hats. They're hand painted. You'll notice right over outside that we're going to continue the celebration after we're done today. Starting at 1 o'clock, our incredible team members and neighbors are invited to join us right here for a day-long activity of festivities. You have food trucks out there, as you could see. You'll have demonstrations. You have awesome partners with art. You'll be able to make a hard hat if you would like. There'll be activities for kids and yoga. So much more and so much fun. I'm now going to turn it over to Steve.
Thank you to my partner Denise and to all of you. Ladies and gentlemen, our hope is that Destination Grand will allow us to rise to the challenge of this moment for generations to come. This is our chance. This is our moment to create something as wise as it is innovative, as bold as it is thoughtful, and on behalf of all our patients and all we serve and all who will come through the doors of this new place, to make it as good as it is great for all Detroiters and for all the world. Onward and upward for Destination Grand. Thank you for coming. Let's do it.